good morning, good afternoon, and good evening, everyone. Welcome to another week of the Global Café. My name is Elizabeth Lewis, and I am a Senior Project and Policy Coordinator here at the IFA. And today I'm very excited to be introducing you all to Dr. Thiago Hérick de Sá, who is a Technical Officer, Age-Friendly Environments at the World Health Organization. Thiago holds a degree in sports science and a master's and PhD degree in public health. He started his career as a physical educator, working with older people at hospitals, primary care settings, and households in Brazil. From 2010, Thiago worked as a researcher in Brazil and in the UK with a track record of scientific populations in high-impact journals. Thiago joined the WHO in 2017 to support the work around urban transport and health, including the development of the WHO's Urban Health Research Agenda 2022. And the source book on integrating health in urban and territorial planning 2020, and the adoption of the global use of the HEAT tool 2021. In 2022, Thiago joined the Department of Social Determinants of Health to lead the work on the age-friendly environments, including the coordination of WHO's Global Network for Age-Friendly Cities and Communities, the development of the Guide for National Programs of Age-Friendly Cities and Communities, and the technical support on age-friendly environments to WHO member states. So as you can tell, Thiago has accomplished very much in his career so far, and we're super excited to have him join us today on Global Cafe in celebration, an early celebration of World Cities Day on October 31st. So we will be discussing today what countries can do to sustain and create age-friendly environments. So thank you, Thiago, for joining us.
Thank you, Elizabeth. Thank you very much, for the invitation to be here. It's a great pleasure to be back to the IFA Global Café, and of course, a huge thanks to all of you joining us in this conversation today. I see some familiar faces, so it's always nice to see good allies, and also a pleasure to meet those I've been meeting for the first time.
Wonderful. Well, I wanted to start today's discussion just by asking a little bit more about yourself. So maybe we'll just start with what ignited your passion in this field, and how did you get started coordinating at WHO's Global Network for Age-Friendly Cities and Communities?
Right. Well, Elizabeth, you introduced a bit of my trajectory.
Yeah.
I've always been like driven by this idea of creating a better future through public health, right? And this, yes, started with my volunteering work with older people in hospitals, primary healthcare facilities in Brazil, where I am originally from. Then as a researcher in Brazil and in the UK, and then of course ultimately at WHO, because there's no better place to be if you're passionate about public health. So after working on urban environments within WHO between 2017 and 2022, I came into this new position of which included the role of coordinating the WHO Global Network for Age-Friendly Cities and Communities. And that was actually one of the main reasons for applying to this position in the first place, because it makes a huge difference to have like a global community you can work with, that is committed to creating an age-friendly world, and it's really behind this for so many years. So in a way, I benefit from the tremendous work and achievements that has been done by many people that preceded me, including some that are in this call today.
Wonderful. Thank you for a bit more context there. It's Thiago and I work closely together, but it's always nice to hear what inspires someone to get close into their work. So thank you for sharing that with us. And although many of our audience members are likely familiar with the concept of age-friendly environments, could you help set the stage for those who are maybe less aware of what that framework is, by explaining the concept of age-friendly environments and their significance within the framework of the UN Decade of Healthy Aging?
Yes, I can. So environments are really important if we want to make sure that people age well, that they age with health for as long as they live. That there's so much that an individual can do, or that our genetics allow us to. So we really need to intervene on the environments to make sure that we live healthy, fulfilling lives. And an age-friendly environment is basically it, is an environment that enable people to be and do what they have reason to value, and to be included in society, to contribute to society if they want to continue learning. There's no reason why we should stop learning, no, after a certain age, to grow, to make decisions on its own, including decisions on how our environments should or could look like. So to be able to age in a place that is right for you, and then the place that is right for you will depend ultimately on your wishes and needs and aspirations. And so that's basically what an age-friendly environment is. And age-friendly cities and communities are a very effective way to deliver on those environments, as we've seen over the years now in many places from around the world. And the one very important element for that is the centrality in all the people. It's ensuring that within those processes, the meaningful engagement of all the people happens, whether we are discussing priorities for an action plan at the city level, or options for age-friendly homes, or how to tackle ageism. In every single activity and decision, age-friendly cities and communities are designed in a way that all the people is central to those processes. Now, you mentioned, and I forgot to highlight that, the UN Decade of Healthy Aging. We are under the UN Decade of Healthy Aging 2021, 2030. There are 4 action areas under that decade, and the decade is really this global concerted effort to ensure that we create this age-friendly world we would all want to live in. 4 action areas, one of which is age-friendly environments. So there's a clear recognition that in order to promote and deliver on this vision of healthy aging, we have to develop age-friendly environments across the globe.
Wonderful. Thank you for expanding on that. And certainly it does highlight also the importance of achieving age-friendly environments when it's set at such a high global stage, that it truly is something that we can all strive to improve on and achieve better on. So thank you for highlighting those connections there. And as you have become very well versed in understanding what age-friendly practices look like across the world, could you share some examples of innovative policies or programs from leading countries that have joined the global network and are committed to becoming more age-friendly?
Well, yes, I think that to start that response, I think it's important to highlight that when we think about age-friendly cities and communities, the very first thing that comes to mind is the work at the city level, right, at the community level.
Mm-hmm.
And it should be, because the protagonism should really be at the local level.
Mm-hmm.
But there's also a very important role that regions, provinces, states, prefectures, counties, and national authorities have to play. So in terms of what countries, leading countries are doing, I think it's important to highlight that the UN Decade of Healthy Aging that we've just mentioned, the action plan of the decade calls for countries to develop their national programs for age-friendly cities and communities. Really, creating an ecosystem where everybody, different levels of government and different sectors work together. So the good news, and I think that this some of you may be familiar with already, but for those who are not, is that the UN Decade also tasked WHO to develop guidance to support member states in developing those programs. And we have it available already, being used and tested in many countries. It's also available in several languages. We know that language barriers are a common issue for us to advance in this agenda. And I'll kindly ask Luana to post the link for the guide and the toolkit on the chat box, just so that you can have a look at. Because in that guide, you will have several examples of what countries are doing. And I apologize in advance, I will not do justice to everything that is being done across the global
Of course.
network, but I would like to highlight some examples, right? So one thing that those programs should be doing and are doing is to connect, right? Connect cities and communities, connect researchers, connect civil society. So the Spanish program, for example, they have annual gathering of rural communities. They also have one for the whole network, but they have one specific for rural communities, right? Because the issues in rural communities are very different. Or the AARP, and I see some colleagues from AARP here. AARP leads the national program for the US. They've just developed a web platform, where the different cities, communities can come together and learn from one another. Or the Emirate of Sharjah in the United Arab Emirates, they are doing an amazing work of like making sure that the sectors talk to one another. Or resourcing, which is another important element, right? We have national programs with funding schemes. So they fund communities to do the work. Sometimes they even fund communities for them to self-organize, right? And we have examples in New Zealand, in Wales, in Chile, in France, or research, monitoring and evaluation. So some examples on that. We have very good examples in Quebec, in Canada, and Kanagawa, one of the Japanese prefectures. Or capacity building, right? We need to train people on how to implement age-friendly cities and communities, how to create age-friendly environments. Then you can look at Slovenia, Western Australia. There are also concrete examples of specific sectors, right? So housing, transport, combating ageism, outdoor spaces. So maybe just two examples that come to mind. One is the Age Friendly Homes program in Ireland that is now fully national. It's across the country. There's an amazing intergenerational program in Norway called Generation Games, which is now again across the country and embedded in the legislation as one of the policies, to promote health. And then one last point I wanted to flag here is the importance of the strategic thinking and the creation of a mandate and the creation of pieces of legislation that ensure the legitimacy and the continuation of this work. So important also when we think about the national level, not just about the executive side of things, but also the role of parliamentarians in supporting developing this ecosystem.
Thank you for that, Thiago. And my next question was very similar, so perhaps we just build upon when necessary. But have you noticed, I guess, in monitoring the success of age-friendly cities and communities, have you noticed a difference in sort of what success looks like and what it doesn't look like, or what strategies are essential for countries to implement to sustain age-friendly environments over time? And I guess I would also add to that as well. How does joining the global network in particular support countries in maintaining these efforts?
So success looks like when people follow the underlying principles, and I've mentioned some of them, right?
Mm-hmm.
The centrality of all the people, focusing on people, their needs and aspirations, ensuring that environments are created and sustained in a way that is conducive to healthy aging. Of course, how exactly this is laid out will depend on the context you live in, right? And then once again, the importance of making sure that this is done with and not just by all the people, right? It's with and for, even more than just by or for them. Sorry, it's with and by, more than just for them. Right. So then I think that that's the most important one. The second one is when you have an ecosystem where different stakeholders, different organizations have a platform, a structure, a mechanism to work together. Right. So when you have integration between the public sector, the policymakers, the practitioners, academia, research centers, the private sector as well, civil society, all the people's representatives. So it's when you have those platforms where people can connect. Also, when you have that high up in the political agenda, and this doesn't come from scratch. Oftentimes, it's a result of a concerted effort, a joint effort of different stakeholders working together. And then, of course, when you see the implementation of activities, of actions, and the continuous evaluation of what we achieved through those. So trying to be as evidence-based as possible, just so that you can inform the next steps and not to make the same mistakes. Now, joining the global network and being part of the global network offers members and affiliates from the very local, from rural communities all the way up to the national and international levels, a platform where you can do exactly this. You can connect with others that are walking the same path and trying to create an age-friendly community, an age-friendly country in their specific sphere that helps you to be inspired, to get some insights, but also to inspire others. It gives you a sense of belonging. I think that this is important because like in many of those programs, including national programs, they are run by 1, 2, 3, 4 people. And we have some of them in this room today. And it can feel quite lonely, you see, the day-to-day work. So giving that sense that I'm part of something bigger. And of course, the support that you can get, as well as the legitimacy, right? That, okay, this is something that is not just me with wishful thinking. There is actually a well-established framework. There's people behind it. There's a critical mass. There are examples I can build from. There's this global community I can rely on as well to do the work on my backyard.
Yeah, thank you for elaborating that, Thiago, and thank you for those who are part of the network for joining us here today. I'm going to tap into some of the audience questions that are coming in, and again, please feel free to add any comments and questions that you do have in the chat. Our first one here is from Barbara. If you are here and are wanting to say your question out loud, feel free to raise your hand. Otherwise, I'm happy to read your question out for you. So I'll give you a moment. Oh, there we are. Thanks, Barbara.
My question is, with regard to smaller areas, I'm from a joint rural and urban area, and we're run strictly by older adults and volunteers. And what we're finding is there's just not a lot of support out there in terms of resources, because it depends on your environment and what they have. So our political arena, we they don't have a lot of money either. So what do you do there? Where do we go in terms of priorities? We have gone right back to older adults and asked them what their issues are. And those are the ones that we are focusing on as projects, but they wouldn't necessarily align with what you're saying to do in an age-friendly community. But I'd like to know, is there anything else we can be doing in that environment, that is?
Thanks, Barbara. I'm just taking notes here. Yes, so that's an excellent question. And I think it touches upon the fact that oftentimes the cities and communities, the local authorities are under-resourced, right? That's the norm across the world. And if it comes to the smaller you are, oftentimes the less resourced you are as well. Rural communities, remote communities, even more so, right? So what to do in that particular context? Well, again, first thing I think is to make best use of the resources you already have and look for inspiration in places that are doing a similar type of work, because you may find some very interesting ideas there, right? There are several low-cost interventions to address certain needs, certain aspirations that can be implemented, and I can point you to some guidance on that. But of course, there's so much that you can do with limited resources that we have. So the second one is to do an asset mapping, just because sometimes you have resources that you don't recognize as such. Rural communities are actually particularly good at identifying assets, community assets, and building on that. And that's actually part of the reason why communities still exist in a lot of rural environments, none this social technology that we lost in big cities. But of course, go there and recheck whether there's any assets that you could be using. And by assets, I mean not just physical spaces, but also existing networks, established communities, some capacity amongst those that live in the area. So all those different cultural assets that you may tap into. And then the third one, of course, is to advocate and push for additional support from higher levels of the government, because there's so much that cities and communities can do, and there's a role for state level and national level to play as well. And again, there are very concrete examples within the global network of countries and regions where this happens, where you have, and when it comes to resources, for instance, I've just mentioned, you have capacity building programs, because sometimes the resource that is lacking is technical, right? But you also have funding schemes led by, developed by the subnational or national authority, really to support cities and communities in doing what they identified as relevant.
Thank you, Thiago, and hopefully that answered what you were wanting, Barbara. I'll jump to the next question here. We have another audience question from Shmuel, who's a regular at our global cafes, and he's asking what a role of countries in the creation of age-friendly environments in health services, state and municipal services, and among others, how countries can support improvement of digital literacy amongst older adult populations. So kind of two questions there.
Yes, two questions that I can try and combine in one answer,
Okay.
because in fact, Shmuel's touches upon two of the domains of the age-friendly framework, right? One is on health services, healthcare, and the other one is on ICT at large and digital literacy more specifically. ICT, I'm sorry for the jargon, is information communication technology. I think that countries can do and are doing is, again, to provide that additional layer of support under what's their responsibility, and that responsibility will vary from country to country. Like sometimes healthcare is highly decentralized, sometimes it's more centralized. So, but irrespective of how your country in particular is organized, there is a role for each level of government to play. And that can take different forms, right? Again, so how can we make healthcare more age-friendly? So, or in other words, how we can implement an integrated care for older people that is looking more at the person and the needs rather than the conditions one has. So there are capacity building activities that can be done. There is oftentimes the decisions around how the healthcare system will be organized and delivered falls under the responsibility of the national authority. So that's one example on how countries could work to support the lower levels of government. There's also oftentimes national authorities, they have more capacity to mobilize, conduct, coordinate research. So we need to know more on what works. We have a lot of interventions on digital literacy, for example. We have a number of interventions on how to tackle digital literacy, but we don't necessarily have evidence that all those interventions work in one specific context. So there is a role that is sometimes more easily played by a national or subnational authority in coordinating research for us to get the responses we need for what we are implementing. Just some of the ideas that that come to mind here. And then one last point, perhaps important to highlight. I mentioned the example of Spain bringing together rural communities that are committed to become more age-friendly. That is true also for, say, those that are concerned with bridging the digital literacy gap. So there's a convening power that countries can play in bringing together these different stakeholders interested in, committed to working on a specific domain, a specific topic.
Thank you, Thiago. And building on the idea of digital literacy, I guess I also want to ask, how can technology be leveraged to enhance the accessibility and inclusivity of age-friendly environments?
I think that there's a huge potential, and we have some very interesting evidence-based examples on how this can be done. It's also important for us to consider that in using a technology, we have to make sure that they also do no harm. And we shouldn't take for granted that technology can support us in many ways, but it can also bring unintended consequences that have to be addressed up front. So one very concrete example is when it comes to the use of artificial intelligence. In some cases, if not well thought through, artificial intelligence can amplify and reproduce ageism.
Yeah.
So yes, there's a lot of potential for technology in improving the lives of older people across the different domains that I've mentioned. So making sure that you have virtual communities for people to connect, using technological solutions for people to be able to access more easily services and opportunities that they wouldn't otherwise, including health and social care. So there's a lot that technology can do to support the creation of age-friendly environments. But there's also the need for us to be mindful that this should be really thought through to avoid unintended negative consequences. And then again, back to the point I made previously, it's really important for us to start producing more evidence, creating a culture of evaluation for interventions, just so that we have a better understanding on what works for whom. Because several interventions that are out there, they are, well, for some of them, we have good evidence that they work. For some, we have good evidence that they don't work, and we should perhaps stop doing them. But for a lot of them, we actually don't have evidence whether they work or not, and if they do, for whom exactly.
Right. Thank you for that. And this is sort of similar to our conversation we're having now, but Tina in the chat also has a question about the mechanisms. Tina, if you're here and want to unmute, you're welcome to say your question. Otherwise, I'm okay to read it out loud. Okay, so Tina is asking, is there a mechanism for reporting progress in different countries?
Yes, there are different mechanisms for reporting progress. One is, of course, on the regular reporting of the UN Decade of Healthy Aging. For those interested to know more on where we are in the progress of the decade, we have released a progress report on the UN Decade of Healthy Aging, which brings together reports from member states on what they are doing to fulfill that vision of creating an age-friendly world. For the ones that are for the countries that have national programs affiliated to the global network, we also have the reporting process of the global network, of the WHO Global Network for Age-Friendly Cities and Communities, as we want to make sure that countries are progressing in their commitments as well, and that is done on a regular basis, on an annual basis, for the ones that are part of the global network.
Thank you. And thank you also to Gail and Jane. I see that you're putting some resources in the chat there, and Mark as well. So thank you for putting those resources in there, and please do feel free to check them out. So thank you for adding to the conversation in that way. I also wanted to ask just a more, I guess, a smaller scale question, but in looking at cities and communities, how can pre-existing infrastructure be adapted to accommodate the mobility and accessibility needs of aging populations?
Yeah, I think that's a very interesting question, Ellie. I think it goes back to my point on asset mapping, right?
Mm,
That's identifying oftentimes cities and communities, one of the first things they do when they plan to commit to become more age-friendly and join the global network is to map what they are already doing.
mhm,
And oftentimes they're already doing a lot on these different domains, no, to improve the lives of other people. It's just scattered. It's just
mm,
uncoordinated. It's just not the segment. There's no coordination across sectors. It's not thought through. So sometimes what an age-friendly program does is really to create this platform where everyone can come together
mm,
and better coordinate the work. And that is also true for the built environment, right? Because then you allow through these exchanges, you allow eventually planners, engineers, architects to start considering the age friendliness of the infrastructure put in place. Like, is this going to be age friendly? Is this future proof as well? Am I building into this new school another purpose for that building 20 years from now? Because we already anticipate that we'll probably not need that school anymore,
mm,
right? But then it would be, so what do we do with that infrastructure that we are putting in place now? Like, are we being able to develop homes that can be adapted depending to the needs and aspirations of people at different parts of their lives? So all these considerations are much more easily done, and these exchanges much more easily done when you actually have a program in place, a space where these conversations can happen.
mhm. Thank you for elaborating on that. And I really do like the comment you make about schools and what their future use will be. And I think of a large part of the conversation of age friendly is also environmental sustainability and ensuring longevity and being aware of what is occurring in terms of the climate crisis. So I guess I would also ask, building on top of that, how can green spaces and eco-friendly infrastructures improve the well-being of older adults and contribute to age-friendly environments?
Oh, they contribute to the healthy aging, not just of older adults. So green older adults for sure, but to the entire population. And green spaces they provide a several of health, social, and environmental benefits, including those related to mental health,
Mhm,
access to physical activity opportunities. Is oftentimes, those are, if they are available and accessible in a way that is conducive for promoting physical activity, then you create a space that you wouldn't have otherwise for this type of practice. In many ways, green spaces they promote intergenerational contacts
mm,
as well, because they also enable the more, they are also oftentimes public spaces as they should be, but then you increase the availability of public spaces for people to enjoy and shape according to their will, if the processes for them to intervene in the environment is there. So there are many benefits, and then of course, once in addition to those, you have all the environmental benefits from maintaining, sustaining, nurturing those green and blue spaces in the environments we live in.
Thank you, Tiago. And Mark has also put in the chat repurposing of old schools in Ontario, Canada. So if anyone's interested in looking at how initiatives like repurposing old schools can contribute to sustainability, please do check out the link that Mark has posted in the chat. Gail also says that in DC we have added lifelong learning as a domain. Wonderful.
And
Okay.
And
Yeah.
if I may build on Gail's excellent point, I think that this is something that is quite interesting within the global network, right? Because WHO offers a starting point, right? This framework with the 8 domains and the age-friendly cycles people can depart from. But of course, like oftentimes in consultations with other people, one of those domains may drop, or another domain may be added, or domains may be combined. And I think that that flexibility in a specific context is really important as well. So it's not to have to consider this framework as written in stone,
Right.
but really know a starting point that can allow people to start having those conversations and helping with the direction of the work on the ground. And then to Mark's point on like repurposing old schools, I would really invite you to have a look at the work that is done under the global network, including some of the age-friendly practices that we have in our global database, where we try and compile as many practices as possible across all these different domains, because there's a lot of innovative, exciting, interesting work out there on how to retrofit infrastructure, on how to build them in a way that they're more future-proof, on how to build intergenerational communities. We know that architecture and design can really help us improve the environments we interact with on a regular basis, or completely hinder their capacity to help us age well as well. So
Thank you. And Jane also put in the chat here that using faith-based organizations for open spaces is also a good use of space, and to use these spaces for cafe time clubs, knitting groups, discussion groups, exercise programs, and intergenerational programs. So thank you. Thank you for also highlighting that as well, Jane.
yeah, and it takes me back to the comment I made to Barbara, right? Faith-based organizations are oftentimes one asset in a given community that in many ways can really help, And I've seen several interesting examples of faith-based the spaces, infrastructure being used for different functions. See, so especially in places where you have limited resources, how can we create spaces that are multifunctional? Right? They serve as a space for a community gathering in the morning, and then you have classes in the afternoon, and then you may have a mass, or you may have a religious activity in the evening. And in doing that, you foster the creation of a community. Because even if you're not necessarily from that religious community, then you're now in contact with that religious community. And the same applies to sports communities, arts communities. So those are amazing assets that communities oftentimes have that we can tap into for creating age-friendly communities.
Thank you, Thiago. And Vincent has a question in the chat that is elaborating on this conversation we're having now about cultural elements. Vincent says, how important is the country's cultural and socio-political backgrounds for the success of age-friendly proposals?
I think it's really important that we acknowledge those aspects, right? The social political background and the cultural background, and we consider them because what an age-friendly community, an age-friendly country means will vary, and it's not necessarily for any of us to decide for others what that actually means. It's for them themselves, right, to get together and discuss in our context what would that mean. So acknowledging the backgrounds, the social political, the cultural backgrounds is really important in that aspect. Also, the organizational, and I've just mentioned the way health services is organized in a country has to be considered in trying to develop an age-friendly healthcare system, right? Same as for housing, same as for social, same. So doing the understanding the context, the local and national context in these different aspects is really important.
Thank you for elaborating on that. And kind of jumping back to the previous conversation about the repurposing of faith-based organizations, Gail has a question in the chat. Gail, do you want to unmute?
Am I being heard? Hi,
Yes.
everybody.
Yes.
It's great to be part of this international conversation and to hear how different jurisdictions are facing what we all know has to happen. It has to happen. We cannot go on this way without having people working together of all ages. So I'm sorry, but I lost the thread of the question that you asked. Could you repeat, please?
Yes. So we were talking about the purpose of faith-based organizations, and it looks like you're in conversation in the chat now with Renee, about faith-based community promotion and the adoption of age-friendly framework within these spaces.
In DC, we wouldn't be without the faith-based community pushing the whole idea of adopting the age-friendly initiative with the mayor and with the DC Council. It was the major strength that got us where we are.
Mm.
We've been around and doing our work since 2013, so we're not new at this. We're into our third 5-year plan, so we're.
I was about to say that, Gail.
So it's been a ride, and we've been involved with the international community in the past, and it's really a pleasure again to talk with you.
And if I may go back, Ellie, to one of the points I made, you see, this is the example of the DC, for instance, right? The challenges they faced, the solutions they found, the experiences they had, the things they tried and failed, the things they tried and worked. It's like all these is an invaluable resource that you can much more easily tap, into if you're part of the global network. Of course, you don't need to be, like you can always reach out directly, but by being part of the global network, they really have this platform where these different cities, communities can connect, learn from one another, support each other. We have several collaborations happening, city to city, country to country, community to community. Oftentimes we at the Secretariat are not even aware of, and I don't think we necessarily should be aware of, but what we should do is really to nurture and enable communities to learn from one another and build on the examples, not such as the one from DC, because this is really what makes us a network and a global community.
Thank you, Thiago. And it looks like I've skipped over a audience member's question from earlier, so I'll just jump back to that now from Meryl. So Meryl is asking, when looking at the SDGs and other decade initiatives, such as the Decade of Road Safety, how do you see the role of age-friendly leading with evidence-based practices when governments tend to focus on youth?
I'm not sure if I understood the question entirely, so apologies in advance if I didn't respond accordingly. I think that there is oftentimes a misconception around creating age-friendly citizen communities, which is sometimes reproduce the generation divide in some places. Oh, so this is all about older people. This is all about the same as for child-friendly cities. It's all about the youth, and this is definitely not the case, right? There is, of course, a political reason for us to have the UN Decade of Healthy Aging, which has to do precisely with the historical invisibility in the political agenda of the issues that are relevant for those in the second half of life. But that is not to say that age-friendly citizen communities should just be, or age-friendly environments should just be for older people, right? It should be for the older people of today and other parts of society of today, and for the older people of tomorrow. Because now, if we are lucky enough and try and do some things right, now ultimately we will benefit from the solutions, from the age-friendly environments we also create today. Now, when it comes to the synergies between these different agendas, I think that some countries and some cities are being quite clever in leveraging one another, because of course there are some overlaps. This on the SDGs, for example, developing age-friendly environments will clearly respond to several SDGs. The SDGs on gender, on health, on cities, on transport, so this on partnerships. So some cities and communities, and countries, of course, they're being very strategic in how to build on these different global political agendas and to maximize the work that is done and to catalyze resources and political attention to these topics.
Thank you, Thiago, for answering those questions. And I guess moving towards bigger scale pictures of the age-friendly framework, what excites you the most about the progress that you are seeing that's being made towards the success of age-friendly environments?
Let me think.
It's a big question.
Let me think. What excites me the most? I think that what excites me the most is the fulfillment of the mission of the global network. Is when I see that by connecting people and by having them inspiring one another and supporting each other, we see progress. So that's and that goes from like a tiny little initiative in the countryside of Spain trying to tackle social isolation and loneliness of those living in remote communities to very large scale national programs for intergenerational cohabitation, or a new piece of legislation that then enables all the people to have access to transport systems just so that they can continue to be and do whatever they want to do in their daily lives. So I think it's to see that in my day-to-day work that being able to fulfill the mission results in progress on the ground, whether from a very small community to all the way up to the national level.
Absolutely. And for those who are not a part of the global network who are joining us today, how can organizations or even just individuals who are interested in getting involved in advancing the strength of age-friendly cities, practices, and communities, how can they get more involved in the work that's going on?
So again, I think the very first thing is to get to know what your community is doing. Right? Whether your community is part of the global network or not. If it's not, we hope you can serve as a strong advocate for that community, that city, to commit to become more age-friendly, not just so that others can also learn from that community, but we can also enhance our accountability, transparency, and make sure that your community gets the support it needs from others as well. And again, age-friendly word is a good starting point for that, right? So both when it comes to the network members, but also to the practices, right? See if your community is reporting on any particular practice that you could be involved in or you could be supporting. This is one thing. Related to that, of course, the connecting, again, it's like making sure that you're part of the solution with what you have, whether you are an engineer, a professor, part of a civil society organization, whether you're a policymaker, a practitioner, just try to be involved as much as possible in the work that is being done. And then in that, try and reflect in your own capacity what you can do to contribute more, whether it's taking the lead on developing an activity to respond to a need or an aspiration that people in your community identified as important, or reflecting to which extent the organization you're in is age-friendly, say I am an academic. Like, is my university age friendly? Is my university enabling all the people that wants to pursue as first, second, third education to actually come in and sit next to these younger people and have classes and become lawyers? Or how age friendly are the policies in the company I work with? So are we being ageist in the policies that we have? Is this design age friendly, the one that I use on a daily basis? Or if you're a policymaker, how can I embed age friendliness if I am not directly involved in this work, in the programs, the policies, the projects that I'm leading on?
Mm-hmm. Certainly many ways for folks who are interested to get involved. So thank you for sharing some of those ways. We are unfortunately coming to a slow close of today's session. Before wrapping up, I really would love to hear your larger sort of takeaway messages from today's discussion. But first, to allow you to gather some of your thoughts, we will introduce our topic and speaker for next week. So next week, please join us in our discussion and conversation with Professor Roger Nags for IFA's second session on the pain management series to discuss understanding pain management and chronic health conditions. So thank you for sharing that, Luana, and that will be our speaker next week. But back to you, Thiago. Could you share some of your larger takeaway messages for our audience today?
Well, first of all, just a piece of advertisement for those that are here. We are now, I've mentioned training, capacity building several times. So this is something that we invest a lot of time and energy to make sure that people get the skills, the knowledge they need to do this work. And the last initiative that we are putting in place is actually an online self-paced learning opportunity, a MOOC, massive open online course on the basics for age-friendly environments that will be launched on World Cities Day on the 31st of October. The Spanish version is already available, and we will soon have the English and the Portuguese one as well. So just for you to know, please, I encourage you to join and to disseminate this opportunity widely. My takeaway message is very straightforward. It's just for us all to continue building an age-friendly world together. Let's keep doing the work that we are doing and try and leave this planet a better place than the one we found when we got here.
Exactly. Thank you so much, Thiago, and thank you for being so generous with your time here today. We really have highlighted the importance of ensuring that nobody is left behind, including older populations. And before we signed up, I also want to remind everybody that we are running, IFA in collaboration with the WHO is running the Age-Friendly Environments Echo Session, which the next one is occurring on October 29th, which aims to help build the competencies to lead, influence, and implement the development of age-friendly environments. So our second session, again, is on the 29th, and it will center the topics of planning strategically. So I really want to encourage anyone who is interested to check out the link that Luana has posted in the chat there to register for the following events to continue the conversation that we've had here today. So again, thank you so much for your time here today, Thiago, and thank you again for another great week of our Global Cafe. And a dedicated thanks to all the incredible people at the IFA who makes this happen, especially Luana, who's helped us here today as well. And thank you all. Have a great Friday and a wonderful weekend, and looking forward to seeing you all next week. Take care.